our old agenda, the Millennium Development Goals agenda, where maternal mortality, under-5 mortality, and AIDS, and malaria were in the focus, made big progress. Basically, we have reduced the number of people dying from those three challenges with more than 50%. But the challenge of today is the premature mortality of non-communicable diseases. We have 16 million people dying before the age of 70. People's lives that could very much be saved, a lot of those diseases can be prevented. 16 million people dying prematurely from NCDs today, mostly in low and middle income countries, mostly being part of the lower socioeconomic groups of countries. This is twice as many people who are dying, or children that are dying today, combined from maternal mortality, under-5 mortality, and AIDS, and malaria. Not saying that we need to continue this work, but we need to get our figures and our perspectives right. If we now look 50 years ahead, what needs to happen? What needs to happen to those trends that we have experienced now during the last 50 years and that have given us some major challenges in terms of where both people's health and the planet's health is moving? We need to ensure that those trends are changing in terms of direction. In order to do that, we need to understand what are the tipping points that are enabling politicians, private sector, and us as humans to take different directions, different decisions in order to be able to save not just our lives, enabling us to live healthy lives, but also our planet. Sir Andy Haynes will speak more about the co-benefits later on, but personally, I believe that that is one of the biggest opportunities really to change those trends. That is to look for those positive co-benefits that we all have an interest in and we can agree on. I was delighted to listen to the leaders at Glasgow last year at the COP. Major progress in terms of realizing that we have a global climate crisis and we need to take action, and we need to take action now. Do we have the same understanding and political commitment to health? No. Definitely not coming out of this pandemic, but more generally, no. Are we hearing our politicians at the same time as they speak about food, agriculture, water, energy, climate, talking about the positive health impact and how we can save at least those 16 million lives that we are losing today? No, we are not. We have quite a lot of homework to do here, not so much to do so much differently or to change the agendas, but to ensure that we get the co-benefits, the communication, the visibility, and people's knowledge about what are those co-health benefits right. In summary, I think what illustrates what we should be looking for, what we should strive for, is to think about more healthy societies. Societies where people can have the opportunities, people have the means, people are empowered to make more healthy choices for themselves. And those choices, here we have the co-benefits for the climate and the health agenda that I'm sure we will hear more about later on. But just three very practical examples. Societies where the preferred option is to bike, not to drive. Where the preferred option is to cook and save your food and not waste it instead of buying fast food. And when the option for children is to enjoy their afternoons in the playgrounds or playing football instead of sitting inside and looking at their iPhones. Those are changes that are related to you and me, but those require also big changes in our societies. So my message, my final message here, in order to get back on track in terms of those trends that have taken us today in the wrong place, we need to do three things. The first thing is to unlock the health benefits from what we do in what is not health sectors. The majority of where we can have an impact on people's health come from the non-health sectors. Health services is important, but the major impact on people's health needs to come from, or is coming from, non-health sectors. The first thing is to unlock that and to visualize and to have clear targets and figures for us to be able to see whether we are making progress or not. Second is to incentivize so we can get those tipping points actually happening for private sector, for politicians, and for us as human beings. And the last thing is to co-create an environment where we at the local level, in communities and in cities, are actually joining hands making this happen. So unlocking the health benefits, incentivize the tipping points, and co-create working across sectors are my main recipe for how we can change these trends. We need to demand it, but we need also to do it, because we have a responsibility for making this happen. Thank you.
Thank you very much, Dr. Anders. I think there are some really very clear message there on what we need to do. And I think the next speakers will also explore some of the elements, but we need big changes. And we also, I think we need to have enabling environments for better choices and healthier choices. And the issues are connected. Our next speaker will be Dr. Jenny Miller. She is the Executive Director of the Global Climate and Health Alliance, where she coordinates the joint efforts of national, regional, and international health organizations addressing climate change. The Alliance works to minimize the health impacts of climate change and to maximize the health benefits of climate solutions through leadership, advocacy, policy research, and engagement. On behalf of the Alliance, Dr. Miller co-chairs the WHO Civil Society Working Group on Climate and Health. Dr. Miller, the floor is yours. Looking forward to hearing from you.
Thank you so much. Really pleased to be here. So my task is to talk a bit about the health impacts of our dependence on fossil fuels. And for all that fossil fuels have historically made an important contribution to economic development, at this point, they are really doing more harm than good. So outdoor air pollution, mostly from the burning of fossil fuels, causes over 4 million premature deaths per year. According to the World Health Organization, 9 out of 10 people currently breathe air that does not meet WHO guidelines for air quality. And those guidelines, we know that air pollution, actually that there's no safe level of air pollution. So there are guidelines for air pollution, targets for air pollution limits. But in fact, the research is showing that you see health impacts from air pollution even at the lowest levels of exposure. We know that air pollution drives cardiovascular disease, respiratory illness. It has prenatal impacts, developmental impacts on children, and drives certain cancers. So air pollution from heating, electricity, transportation, and industry are significant, drive significant impacts on people's health. Unfortunately, fossil fuels don't just start harming people's health once we're using them, once we're burning them. Even the extraction process and the transportation process for securing those fossil fuels and the processing of them also have impacts on people's health. Black lung disease in coal miners is a major issue. We've seen the impact of major oil spills on fisheries with significant impact on people's nutrition and livelihoods. The new forms of extracting oil and gas, fracking, have health impacts. Those are not yet well understood because there's just emerging research looking into those. But there are emerging studies and emerging evidence that there's significant health impacts from fracking. And then transporting fossil fuels, processing them as well, create these exposures that have impacts across the board. And then getting into climate change. So fossil fuels are a major driver of climate change. Energy systems are responsible for nearly 3/4 of global greenhouse emissions, and about 80% of global energy currently comes from fossil fuels. oil, gas, and coal. I suspect that many folks joining this webinar are somewhat familiar with kind of the litany of health impacts of climate change, but just to kind of review some of those. We're seeing increases in foodborne, vector-borne, and waterborne diseases. Extreme weather events such as heat waves, storms, and flooding drive injuries, drive water quality impacts, drive people from their homes and create a myriad of health impacts from people being dislocated from the stable conditions of their lives. Food systems are being disrupted both by droughts and by superstorms and flooding, which drives food insecurity, hunger, and malnutrition. And actually during the pandemic, we saw those nutritional impacts being compounded by some of the supply line and other disruptions of the pandemic. So the pandemic combined with climate change driven drought and so forth really exacerbated malnutrition and hunger in various parts of the world. Rising sea levels are destroying people's homes. They're also impacting healthcare facilities. So those facilities that people turn to, this is true for extreme weather events as well, those facilities that people turn to take care of their health in an emergency or when impacts are being felt are themselves feeling the impacts of climate change. And then I was talking about air pollution earlier. We're seeing extreme wildfires all around the world these days. And those extreme wildfires are creating wildfire smoke. Because the wildfires are lasting longer, they're bigger, that smoke has the capacity to drift. Far more people are being exposed to additional air pollution from wildfire smoke. From where I sit at the Global Climate and Health Alliance and interacting with both health organizations and other kinds of organizations around the world, we're seeing concern about the health impacts of climate change really, really ramp up these days. And I think some of that is attributable to people just simply becoming more informed. But also part of it is that we're now seeing those impacts in nearly every country in the world. At this point, things are moving much more quickly than I think even some of the science anticipated. So in short, fossil fuels are no longer a fit for purpose fuel for a healthy future. I know that our next speaker is going to talk about some of the benefits in health that we would see if we actually make a transition to clean energy. Thank you.
Thank you very much, Janie. Well, you already helped in the introduction to our next speakers in terms of what he will cover. So Professor Andy Haynes, he's a professor of environmental change and public health with a joint appointment in the Department of Public Health, Environments and Society and in the Department of Population Health. He was previously directly of LSHTM for nearly 10 years, and having previously been professor of primary health care at UCL between 1987 and 2000. We're looking forward to hear about what are the real possibilities and what are the co-benefits of this phase out of fossil fuels. The floor is yours, Doctor.
Well, thank you so much, Paula, for the introduction, and I'll build on some of the remarks of the previous speakers. I'm going to speak quite briefly, but hopefully give you some concrete examples of these healthcare benefits. And as you've already heard, of course, climate change has really worrying and massive implications for human health, negative implications. But the other side of the coin is that as we phase out fossil fuels, as we must, there will be benefits. And these benefits will be in the near term. So they're additional to reducing the risks of dangerous climate change. They're benefits to our health now. By now, I mean in months and years, in addition to those benefits over decades and centuries that will come from preventing dangerous climate change. So this slide just shows us the links, the number of the proportion of deaths from different diseases that are due to outdoor and household air pollution, taken from WHO estimates. And what you can see is that about 20% of deaths are due to pneumonia, about 20% from stroke, 34% from heart disease, 19% from chronic obstructive pulmonary disease, and about 7% from lung cancer. So air pollution, both outdoor and household, is a major risk factor for the very common non-communicable diseases and also common infections like acute pneumonia. And this is often left out when when disease prevention programs are initiated around the world. The crucial contribution of pollution, of air pollution, is often left out from these preventive interventions. So where were these prevented deaths fall? Well, this is a map that from a paper we did a few years ago. We estimated about 3.6 million premature deaths, something of that order, related to ambient air pollution. That's outdoor air pollution, doesn't include household, except as much as it contributes to outdoor air pollution. And this is the fossil fuel component of that. And you can see from the map that many of these deaths would be prevented in India, in China, Indonesia, in Europe, much of Western and Eastern Europe as well, parts of the Russian Federation, and of course in North America. Less so in Africa and Latin America, and that's because of course they combust, they burn less fossil fuels. But there are hotspots in South Africa, for example, burns quite a lot of coal, and in parts of North Africa as well. So depending on the choices that are made in Latin America and Africa over coming years, these air pollution levels could increase. And of course, burning fossil fuels will contribute overall to climate change. It's important to emphasize, I think, that although there are end of pipe solutions, you can put filters on power stations and so on, these will not bring all the benefits to the climate. And indeed, they bring certain hazards, because when fossil fuels are burnt, we also emit cooling sulfate aerosols. And so if we just reduce those aerosols through pollution control mechanisms, then that can increase the rate of heating of the atmosphere. So it's really important to contain or to reduce air pollution by phasing out fossil fuels, and then get the double benefit for the climate and indeed for human health. So where are these, the emission hotspots? Well, you can see them here. This is another map which shows you where many of these greenhouse gases and the impacts of coal power in particular are felt. And you can see that these are the health impacts per coal power plant. You can see that India has some very, very polluting coal power plants with poor emission controls. China has large numbers, slightly less polluting, but very large pollutants in aggregate. And also parts of Russia, Eastern Europe, and to some extent Western Europe as well. It's a few years old, so there's been some change since then, but the broad pattern is still there. And you can see that in South Africa shows up, parts of the US, and of course Indonesia as well. So this coal burning then is releasing particulate matter, sulfur dioxide, as I've said, NOx, and mercury, of course, as you've already heard, is an important pollutant as well that can affect the health of mothers and neonates. But air pollution may also increase the risk of COVID transmission. This is a paper from a couple of years back, which estimated the proportion of COVID deaths that might be related to fossil fuels. And you can see that the exposure to fossil fuels does seem to increase the risks of COVID. That's probably because it increases the risk of the disease that predispose to bad outcomes from COVID. And on the top, you can see the contribution from all the anthropogenic, all the human-induced air pollutants. And on the bottom, you can see the contribution from fossil fuels alone. So you can see that there are substantial contributions of human-induced air pollution to the risks of COVID. And so we need to bear that in mind going forward, because although COVID, of course, is causing many less deaths now, it's certainly not going away. So what about other pollutants? Well, I mentioned briefly NO2, nitrogen dioxide, and one of the other health outcomes that's affected is asthma. And this is a study that was done last year, in fact, published last year, which estimated about 3.5 million incident cases of asthma amongst children and adolescents globally could be attributed to exposure to ambient NO2. That's about 14% of the total. And of that, transport is a major source of nitrogen dioxide, the domestic burning of solid fuels, and power generation from fossil fuels as well. So when you add transport and power generation together, fossil fuels making a really significant contribution, which would be greatly reduced, obviously, as we phase out fossil fuels. And we often tend to forget methane in this story. And methane is incredibly important because it's a short-lived greenhouse gas. It stays up in the atmosphere for about 12 years or so. And it comes partly from agriculture, so reducing our consumption of ruminant products, of red meat, and dairy products in high-consuming countries is good. Fossil fuel operations, gas leaks and so on, waste burning and other sources as well. So it's responsible for about 40% of the heating since the Industrial Revolution, and it's about 86 times more powerful than carbon dioxide over a 20-year period. So we can't ignore methane. And the other important link with health is that although methane itself doesn't damage health, it's a precursor of tropospheric ozone. And tropospheric ozone is an important air pollutant, which causes about 1 million or more deaths, premature deaths annually. And methane is responsible for a significant proportion of those. Ozone causes increased risk of respiratory diseases, heart disease, damages the airways, and also, of course, reduces agricultural yields and reduces, therefore, food security. So there are win-wins in reducing methane emissions, in this case by phasing out fossil fuels, but also by changing our diet and by agricultural practices. And then finally, the transport sector. This has been mentioned in passing. Transport strategies can bring big health benefits, not just from reducing air pollutants, of course, but also increased physical activity. So it's a combination of walking, cycling, more public transport, electric vehicles, reduced dependency on the private car, which are the important factors which can reduce greenhouse gas emissions and improve health. And some of the studies we've done are shown in the title to this slide. Thus, the graph just shows you the benefits in financial terms in the potential annual cost averted to our national health system from getting the urban population of England and Wales walking and cycling like the population of Copenhagen in Denmark. And you can see big benefits in terms of diabetes, dementia, depression, and other conditions. And then finally, in closing, let me just say that we also need to think about reducing any of the negative impacts of fossil fuel phase out. I've really focused on the positive because they are largely positive, but there are a few negative ones as well. And one is, as we transition to a fossil fuel free economy, we need to think about the employment transition. We need to address job insecurity. I've been a medical practitioner myself in a former coal mining community, and I've seen with my own eyes the social damage that's done when communities that depended on mining, in this case coal mining, are abandoned by government policy. So we need to develop net zero occupationally healthy jobs for these communities. And finally, we need to consider the international spillover of the net zero economy. For example, cobalt mining in the Democratic Republic of the Congo. About 20% of that is artisanal. It involves labor of children, often unregulated. There are very high exposures to heavy metals, DNA damage in children, occupational injuries, violence, and deforestation. But of course, there are local benefits because people are desperate and they're very poor. So the important thing is to provide healthier working experiences and to regulate this mining as far as it's possible. So I'll finish there, but leave you with a positive message that overall there are massive benefits from moving towards a net zero carbon economy by phasing out fossil fuels and by other policies. And if we make sure that when we implement those policies, we also think about potential unintended adverse consequences, then we can really reap these major benefits and reduce health inequities and reduce the threat to our climate. Thank you very much.
Thank you so much. I think I was frozen for the last 30 seconds of your when you're finalizing, but I'm happy I'm back. I think both you and Janie made really the case for the absolute need for us to think about phasing out fossil fuels and all the impacts on health, and but also we need to think, I mean, it's needed, but it's not simple. So before we move forward to an interactive panel in which I will shortly introduce the next speakers, I have a question for both you, Jane, and Sir Haynes. What do you consider, I mean, to be the greatest barriers to make progress in phasing out fossil fuels? What would be what type of obstacles we'll need to collectively overcome?
Do you want to start, Jenny?
Sure. Yeah, I mean, at this point, we have the technology, we know the technologies that we need to move towards to replace fossil fuels, but they're being underinvested. You know, fossil fuels are subsidized at a much higher rate than we see public investment in clean energy. In terms of what the actual root of the problem is, though, is that we have very powerful fossil fuel industry. And that fossil fuel industry is lobbying decision makers, investing in decision maker campaigns. They're at the table in both international and national fora where policy is being set. And we don't have sufficient countervening movement to drive the phase out of fossil fuels. So decision makers need to hear from an organized, health community, public, et cetera, that it's no longer acceptable, because right now the fossil fuel industry is holding sway where those decisions are getting made.
Yeah, I mean, I absolutely agree with Jenny on that. I mean, the problem is we are subsidizing our own destruction, which is a rather short-sighted thing to do, because these, as Jenny has said, are very powerful interests. And we're also, of course, failed abjectly to implement any kind of carbon taxes on the scale and the amount that are required. Carbon taxes, the economists tell us, carbon pricing of various kinds is the most efficient way to transition to a net zero economy, but it's not happening. And the reason for that, of course, is, as Jenny said, it's being opposed by special interests. The other thing I think that's extremely worrying, and this is because of the war in Ukraine, and we're actually seeing some countries moving back to burning coal in their desire to escape from being dependent on Russian gas and so on. So the danger is here that there will be a retreat backwards into coal, partly for economic reasons, partly for political reasons. And that's something I think we need to be very aware of and to really counter very strongly from a health perspective.
Thank you very much. It sounds very familiar from many perspectives, either like the type of subsidies that we all in Brazil, for example, we subsidize all the wrong things due to the heavy lobby from the sectors involved. And I think we'll move forward now for this different geographies in the world, and we'll go to Latin America and to India, and also to have a global perspective. So our next three panelists, I'll introduce all of them, and then I'll start with Alejandro. Alejandro is a UNICEF consultant and the director of El Derecho a No Obedecer, the right not to obey. It's a social platform that aims to empower civil society in Colombia to create social change and influence public policies. We need a lot of that, according also to what Jenny just brought in. We need to organize as societies. And then we'll have Dr. Srinath Reddy from India, presently the president of the Public Health Foundation of India, and formerly headed the Department of Cardiology at All India Institute of Medical Sciences. Well, Dr. Reddy, it's also really an important, influential presence in global public health discussions. And then we'll have a perspective from a global perspective from Dr. Sarah Thompson. It's a public health specialist specializing in adolescent health, sexual and reproductive health and rights, including HIV and AIDS and equity in health. She's been working with development issues in sub-Saharan Africa for over 25 years. So we have a really wonderful group now, and I will address one question to a couple of questions to each of them. I'll start with Alejandro. Alejandro, what are the challenges to securing clean air in Latin America?
First, I would like to start asking if you can hear me well and you can see me well.
I cannot see you. I can hear you, but I cannot see you. Don't know if it's. Now I can
Hi,
see
everyone.
you. Yes. Hi. Hi. Welcome.
Perfect. How are you? I wanted to start asking if you can hear me well and you can see me well.
I can hear you and see well. If others do. I see Dr. Srinath nodding and Sarah as well. Yeah, go ahead. Now I think he's frozen. Probably something with the connection. So while Alejandro reconnects, I will go ahead with a question to Professor Srinath Reddy. And then Alejandro will probably be back in a minute. Professor Reddy, why is a just transition away from fossil fuels so important in India? And how can health be protected through a just transition?
Well, India is currently the second most populous country in the world. And within this decade itself, it's likely to become the most populous country. So what happens in India affects the global population in very many ways. And we have seen that in 2019, about 1.67 million deaths, about 12.5% of all deaths were directly attributed to air pollution. And then moving beyond that, all the other consequences of fossil fuels, particularly reflected in climate change and global warming, are being seen. We have had 2 continuous months of unbearable heat in northern India, with the temperatures highest recorded in the last 70 years. And we are also seeing the impact of climate change in terms of extreme heat effects, extreme weather events, of vector-borne diseases, where even as humans wilt and become listless in the heat, the mosquitoes become athletic and reach farther and faster to cause many vector-borne diseases. We also recognize that non-communicable diseases, which have been referred to by others, are a major challenge in India, contributing to 67% of the deaths, but 40% of those deaths occur below the age of 64 years, which means that in the productive prime of midlife. So whether it's diabetes, cancers, mental health, we are all seeing that. Infectious diseases like tuberculosis are likely to get exacerbated by air pollution, and the risk of even COVID and other respiratory infections is also going to be aggravated by air pollution. All of that we're seeing. But one of the areas that I would like to really point out is the impact on agriculture. We know that India, South Asia, and Sub-Saharan Africa are operating at the very upper limit of temperature tolerance of most of the cereal crops, staples. And we have seen the wheat production go down in India in the last 2 months of summer heat, both quantitatively and qualitatively, with the grain shrinking in size. And that impacts the world because India had promised that it will make up the wheat deficit created by the Ukraine war. The Indian government started exporting wheat, but then with the extreme heat, with India's own wheat supplies shrinking, India had to pull down the shutters on the wheat export. And just to close off, what is going to be the impact of heat on India's nutrition? It has been modeled and predicted that by 2050, because of the heat effect, we are going to have 38.2 million more protein deficient persons, 49.6 million more new zinc deficient persons, 396 million women with anemia, and 106.1 million children with anemia. So this is the havoc that's being wrought by fossil fuels, not only through air pollution, but through accelerated climate change. And India is one of the prominent victims of that transformation.
Well, thank you, Professor Reedy. I think the figures are really overwhelming and really brings us to the urgency of really acting on those issues. I don't see Alejandro here back, but then now, Alejandro, are you back? Can we move over to Latin America? I see you there. Maybe
I'm
if the
counting on the
connection is
internet.
bad.
I hope it doesn't fail.
Yeah, maybe we can just listen to voice if the connection is too bad to ensure that we can listen to you. But go ahead.
Perfect. Right now, can you hear me and can you see me well?
I can hear you. So shall I repeat the questions for you? The challenge to securing clean air in Latin America.
Of course, and thank you all for the invitation. I'm so sorry that today got a bit chaotic with the internet. I'm not sure right now if you can hear me well. I'm gonna turn off my camera for a second to see if it works better now.
Yes,
Does it work better now?
Yeah, it's better without the camera. Go ahead.
Perfect. I'm so sorry, but we'll have to go on. My name is Alejandro Dalia. I'm an advocate for clean air in Colombia and Latin America. I'm the co-founder of the National Citizen Network for Clean Air in Colombia, and we have worked since 2018 to promote public advocacy actions, campaigns, policy making at the local level and the national level in Colombia. Right now, when we're talking about air pollution in Latin America, we're talking about more than 140,000 deaths a year due to air pollution. And the truth is that fossil fuels are killing us now. Air pollution is the leading environmental risk to public health in the Americas, not just Latin America, but also the United States, the Caribbean, and Canada. And more than 30 million children in Latin America and the Caribbean live in households where firewood or coal is used for cooking and heating. And if we take it broader, we're talking about more than 130 million children in Latin America and the Caribbean that live in cities where outdoor air pollution exceeds the air quality guidelines of the World Health Organization. And I'd like to repeat this again, because as everyone has stated before me, the truth is that fossil fuels are killing us now. In Colombia, for example, every 15 minutes, a person dies from air pollution. So we can say that while this panel or this conversation started, at least 2 people died from diseases related to air pollution in Colombia. From my organization, my work has allowed me to understand that the climate crisis is a public health crisis and a human rights crisis. Nevertheless, the situation we have is that the narrative is not positioned yet in the public agenda. We're seeing how environmental action and health action are taken 2 separate ways, particularly in youth-led environmental organizations. In our case, we created the first Latin American advocacy school for clean air called New Airs or Nuevos Aires, which has trained over 200 young people in different cities of Colombia, Ecuador, and Peru to use low-cost sensors to monitor air pollution, but also create advocacy campaigns to create awareness about the effects of air pollution. And I'll give you 2 quick examples of how we're doing advocacy in Latin America to change this reality. This is actually how my advocacy journey started. I remember it was 2018. I stood in front of one of the crowded public transport stations in Bogota with a pair of giant cotton meaning the white thing, lungs. And I put it there and I left them there through all one day so people could see what was the effect of air pollution in their own lungs. Well, through art. And the truth is that caused an impact on the public agenda to position air pollution as a top priority in Bogota. More recently, we're working with public schools in Cali and Medellin to work hand in hand with children and professors to create symbols to change the narrative. So for example, if you see some red flags standing in public school in Colombia, because we're using the same colors as the air quality index, that's probably us as well. The thing is here, how can we create such a powerful movement that creates such a strong narratives that positions air pollution as the top priority in the climate and health agenda, which the climate crisis movement have done. And I think what we need is more voices from the global south that allow this conversation to be based on climate, environmental, and health justice. And I put my camera just
Thank you,
again,
Alejandro.
where you can see me a little bit.
I'm happy.
Because that was...
Thank you. I'm happy the connection worked. Well, I think both Professor Reddy and Alejandro, they have really reinforced the case that we really need to move towards a transition. And then I'll go to Sarah. What are the barriers for this implementation, for this transition? What can we do?
Yeah, thank you. Thank you so much, Paula. I think rather than focus on the barriers, maybe, yeah, as you said, focus on how we can overcome those barriers. And I'd just like to build on one of the points that both Anders and others have building on what they said, is that the health sector, I think many of us sitting here today are probably from the health sector, obviously has a responsibility, and we are contributing to air pollution and carbon emissions, of course, but we can't solve it alone, even though we see this enormous impact on human health. As previous speakers have said, in order to reduce air pollution, we have to engage with energy, agriculture, urban planning, transport, and infrastructure and others, and connect this, as Anders said, to the health benefits of the interventions that are happening in those sectors. And I can say self-critically, I think we have not been sort of demanding that enough, or been in those forum enough. So we know that this sort of multi-sectoral approach is necessary, but it's quite a challenge. One area that has also required this is the One Health approach to reducing, amongst others, antimicrobial resistance. And I think that's an area where there's been some success in this type of cross-sectoral work, and especially in the wake of the pandemic. And we need to make that happen in this area as well. The second possible, or I think necessary way to reduce barriers and institute change is really, we need to play the long game. And we need to remember to take always a systems approach. When we only react to heat waves or pandemics, as opposed to sort of changing systems and methods of working, we miss opportunities for potential game changers. And in fact, a crisis is often the best place to change paradigms about the way we work. I remember met the head of Volvo Cars of America years ago, and they had just gone through a humongous crisis. And I asked him, I said, well, what happened? How did you get out of it? And he said, well, if you're in a boat without oars, you have to rethink how do we invent an oar? You need to rethink exactly how you think about oars, how you're going to get back to the shore. And so, in fact, being in that crisis was the impetus for making a huge paradigm shift in the organization. Now, the pandemic was a wake-up call for all of us that's led to greater calls for better health systems, including universal health coverage, and the fact that building back better should include greening the health sector. And similarly, improving air quality, waste management, water and sanitation, safeguarding biodiversity will also reduce the vulnerabilities of communities to pandemics, and thus improve overall societal well-being and resilience. So it's making the connections to these big events that are happening in order to promote system change, and not just expecting individuals to change or reacting to individual events.
Thank you so much, Sarah. And then I think I'll move back to Alejandro, thinking about that question. I mean, what type of to build back, looking at the crisis as an opportunity, Alejandro, could you give us any examples of the work that you are doing in Colombia that are contributing for this system change, not only from an individual perspective, but like if you can share some of your experience with us? I think it has a lot of dialogue with just what Sarah brought in. Are you there?
Yes, I didn't turn on my camera just in case the internet got a bit slow. Can you hear me well?
Okay. Yes, go ahead.
Perfect. I'll give you one concrete example. In the city border between Colombia and Venezuela of Cucuta, in 2020, when we were in the middle of the pandemic, we had our first contingency due to air pollution, mainly because of the burning of the Amazons in Brazil, Colombia, and Venezuela. The wind currents took the air pollution to that city border, and they didn't have any plans to attend such a contingency from air pollution. So we created an advocacy campaign called SOS Cucuta is Burning, and we created a series of dialogues between both the government, the local government in Colombia, Venezuela, and the national government in Colombia to address the situation. This led to the creation of the first clean air roundtable, and later on the first clean air plan in Cucuta, where we currently, as an organization, represent civil society. And this had to, and I'm answering one of the questions that is on the Q&A. I think the first thing we need to do is to start conversations around the importance of this issue in our local communities. I think it's an understanding of air pollution as a problematic at the national and international level, but what we need is that the local public officials, the local public health workers, and the local work environmentalists or NGOs understand the connection between air pollution and the climate crisis. And sparking conversation is a great way of doing that. And later on, I feel we need to engage the people that gather in these conversations to create coalitions that are strengthened at the local level. Meaning, we know we have this international work to advocate for clean air. How can we translate this at the local or municipal level? Which are the actors that need to get involved and need to understand what are the consequences of air pollution in my own city, in my own community. And I think a good way of doing that and engaging a lot of people is through advocacy campaigns, meaning mobilization. So I give you some examples. We have done from a giant pair of cotton lawns to a giant cigarette box in the middle of the main square of Bogota that said, "Bogo smoke, breathing this air is damaging to our health." So how can we use symbols to change the narrative? I think that's a key issue here.
Thank you, Alejandro. Now I move back again to Professor Reddy on your insights on like what role should the health community play, I mean, to achieve this need of like intersectoral action. And I think, well, actually Global Climate and Health Alliance, it's an example of this attempt to work intersectorally. But I would like to hear from you, Professor Reddy, what role should the health community play in that?
Well, the health profession has a very strong convening role and a convincing role, because health professionals are trusted by everybody and they're trusted communicators. So in order to actually provide a convening platform in which different sectors can work together, including the civil society, and a stronger community engagement, apart from the actual people working in managing the various sectors, I think the health community can play a great role. By providing information to policymakers as well as public with great deal of clarity as to the variety and severity of the health effects and the likelihood of these rising in magnitude if we do not take action, I think we can actually catalyze a fair amount of action. But then we ought to also set our own examples by showing how the health sector itself can reduce its contributions to global warming and climate change and reduce the emissions. So the greening of hospitals and healthcare facilities is going to be important. We can reduce our emissions by concerted action. We can actually undertake green procurement practices, influencing the entire supply chain across the way, so that we can actually ensure that emissions can be reduced at various levels of production and reduce the consumption also substantially by adopting green practices. But I believe it's also very important for us to recognize, since the question of what was raised as the potential impact on employment by Sir Andy Haynes as an objection that's likely to be raised, that by reducing fossil fuels, we are likely to be also impeding livelihoods of people. It need not be so. First of all, we ought to be able to retrain and engage them in green technologies, and there is a great scope and need for that. But even in the health sector itself, there are so many jobs to be created. The WHO estimates that 18 million more health workers are going to be needed by 2030. The shortage of global public health workforce was so vividly visible during the COVID pandemic. Every country had a shortage of public health workforce, apart from other trained public health professionals. So we in the health sector ought to be able to offer opportunities for shifting people, particularly in terms of frontline health workers, from fossil fuel industry into the health sector. And then, of course, the very important thing is we must give a call that we are in it together. A global threat requires a global trust. We will need shared resources. We'll need shared technologies across the world. And we need joint investments across the world in green technologies. There cannot be a proprietary restraint into green technologies because the world is in it together. And ultimately, it is a contest between human intellect and human folly. And at stake is the survival of the planet. So we have to rouse the human conscience collectively, globally, to act together. And the health professionals can do it because they represent the people.
Thank you, Dr. Reddy. Then I'll go, since you finalize with this call for like a global consciousness, I'll give it back to Sarah and ask what will be the role of international cooperation in this paradigmatic need to change?
Thank you, Paula. And I can speak from sort of a person who's representing an international development cooperation agency, where we really see our role is in supporting partners who strengthen preventive and health promoting initiatives, both normatively and through cross-sectoral initiatives. So if we can contribute to those areas, we think this could contribute to this. So we're working to strengthen global standards, opinion formation, advocacy, knowledge raising measures, evidence, and public health promotion. Some examples that I can tell you about are, for example, support to WHO, speaking of the normative agenda to implement the Manifesto for Healthy and Green Recovery, strengthening global normative dialogue and raising the connections between poverty, environment, climate change, and health. And this includes greening the health sector. You may have seen recently they released a report on, an excellent report on the health sector's contribution to air pollution, particularly as a result of the pandemic. But also at a national level, for example, in South Bangladesh, ensuring that the health sector is included in national climate adaptation plans is extremely important. We haven't talked so much about climate here, but of course it's all connected. And as these countries, such as the coastal areas of Bangladesh, are reacting to climate change, UNICEF we support there to provide information, health system information to the government, real-time information on climate-sensitive epidemiological trends, building up the capacity of the health workforce and coastal communities to address health risks, and documenting good practices. And then finally, an area that's outside of the health sector, but that CEDA has been investing in for about 8 years already now, is the Power Africa program, which is building up and the energy needs of Africa, but through sustainable solutions. So this is really about electrifying Africa, which is a huge need, but it's doing it in a way that leapfrogs the need for mitigation. So it will have a positive impact on the environment and people's health as they're developing, as they should be able to develop in the way that other parts of the world have developed, but in a way that won't subject people to the burden of air pollution as we've been subjecting ourselves. And it's mobilizing funds primarily from the health sector to de-risk investments in solar powered electrification, but also scaling up clean cooking techniques, which about 900 million people in Africa lack. So those are just some examples of where, both at the national, regional, and local level, we think that international development cooperation can make some contribution, but it's not enough, obviously.
Thank you so much, Sarah. I think we'll move now for questions and answers. And I think we have one question here in the question and answer session, and everybody here in the room and watching are welcome to please pose your questions there. There is one there. In developing countries like Nigeria, transition to zero emission is yet to be addressed seriously by policymakers. How can this be addressed? I think this is if anybody wants to take on this question, Jenny? Can I give it to you?
I'm happy to take a start on it, and I think others would have valuable things to add on this. I mean, as Sarah just mentioned, developing countries have a very legitimate need for increased access to energy. And so we have to kind of take that into account from the get-go. But and so any call for transitioning to, committing to zero emissions has to be in the context of acknowledging that need for energy and thinking through the solutions that, as Sarah was saying, leapfrog and do not require a country to go on the path of using fossil fuels, becoming highly polluted, and then having to, deal with those consequences, but instead take advantage of the technologies that we currently have. Now, what is that going to take? I think technology, technical support in the technology transfer may be a part of it. Financing to help countries make that shift is going to be really important. And then I think we also need to address the kind of the interests of global North countries that are doing some of the investment and development in those countries that are driving that kind of fossil fuel infrastructure, and really take a look at that and challenge that as well. People are profiting from developing fossil fuels and utilizing fossil fuels in developing countries.
Thank you, Jenny. I'll give over to Professor Reddy.
I entirely agree. I think the important thing is not just to raise national consciousness and build coalitions within countries. That's of course important. But unless the international community says very clearly, we are with you in this, we are ready to support you with adequate investment, and we'll help you make the transition, and so that it becomes less painful for people of that country, there won't be appetite politically or in the public unless that happens.
Thank you, Professor Reddy. I think there are some well, one of the questions that I have to all of you and all the panelists and whoever wants to make a comment on, it's because sometimes when I think it was brought earlier and about the power of the lobby of those sectors that still profit a lot. And often, I mean, the case, I'm not far from being an expert in this particular area of energy, but as far as I know, in Brazil, we are subsidizing all the wrong things, and lots of public subsidies going for that. And as it is right now, when I look at also in other areas, if you think about agriculture and like food production, I mean, all the areas I see that the subsidies are going the wrong places. This is entirely linked with a global financial system also. And I mean, and this major group of investors, which are like actually making those profits become even more profitable, even though there is a huge cost to all of us, to the planet, to our health. I mean, how do we overcome this type of like a more macro level barrier? Because absolutely, I think there is a huge need for communities to organize, and I think we need to keep doing that on an ongoing basis and move ahead. But how do we overcome this kind of broader obstacles that we have, which is a huge barrier that we still allow in the global market today, that people profit without paying any of the costs of the externalities? And I think it will be really hard to make incentives for the right things to happen while we still are like funding heavily fossil fuels, for example. Just to anyone who wants to take on that one. Andy, yes.
Yeah, well, I don't have a simple answer, but let me try to respond to the question because it's such an important one. I mean, one is that I think we need to work more with our colleagues in the legal professions. So I think there are about 1,000 climate litigation cases going on around the world at the moment. Some of them have been brought by children and young people against those politicians who basically are damaging their future. And I think we should, as health professionals, we should support those legal cases as much as we can by providing evidence, objective evidence of the impacts of climate change and the damaging effects of fossil fuels. The second thing I think we can do is to devise policies that will, there are different ways of withdrawing subsidies, and some ways may be more publicly acceptable than others. So, for example, if you just try to increase the cost of fossil fuels to the poor, you'll get a bad reaction, as President Macron found in France with the Gilets jaunes movement. So you have to make sure that when you withdraw subsidies or you impose carbon pricing, you do so in a progressive way, which means putting more money into the pockets of poorer people and ensuring that some of those subsidies are recycled as benefits. And one example of that would be the work that was done, for example, in Indonesia, where they phased out some of their fossil fuel subsidies and they recycled that into healthcare, into affordable healthcare. And so the public were much more inclined to support that action because they were getting something from it, something tangible that they could see. And so we need to think of clever ways of recycling the subsidies that in a way that benefit the poor and benefit the climate as well. Thank you.
Thank you so much. It is indeed a challenge to overcome those barriers. We have about 6 minutes left. So there is also one question there. I think it has somehow been addressed. I mean, this thing about being connection between air pollution and climate change understood by the non-scientific community. I think it's about like this thing of mobilizing and making people aware and community mobilization and all that part. But I mean, I have one last question to all of you, and it's more in connection with the global negotiations. I mean, both the governments attending the Stockholm +50 this week, but also the intersessional negotiations of the UNFCCC that will take place next week in Bonn. What will be the call and a kind of a final message translated into a call for governments that are attending these global negotiations, as there is an important role to be played there? If you are able to do that in 1 minute each, if it's not too much to ask. Thank you. Okay, Alejandro, 1 minute to you, and then I'll take each one of you, and also for your final words.
Perfect.
Alejandro?
I'm gonna try with a camera to see if it works, but tell me if it doesn't. Does it work? Yes. So I can get to see you and you can get to see me. 1 minute. I think we really need to find new voices that are able to project the origins of this matter in the public agenda, in particular in COP. And I think that relies a lot on youth organizations and youth-led organizations. How can we empower more young people from the global south, from people that are living and are going to inherit the consequences of the work that we're creating today when we're talking about this connection between health and climate? Where are those voices in COP? We recently saw in COP26 that there was a moment to talk about air pollution. We don't need a moment. We need a clear position of the COP27 agenda that connects air pollution with climate and with climate change and the climate crisis. And I think the key to those two connections are more engagement of youth-led organizations. And that is also a key moment to understand how can that replicate at the local level. So I think that if we want to advance the upcoming negotiations, we really need to find those voices, empower them, strengthen, and take them to the negotiations.
Thank you, Alejandro. I'll give you Jenny, please.
Yeah, so last year, 46 million organizations representing 46 million health professionals sent a letter to governments calling for full fossil fuel phase out with a just transition. And I think both of those things are absolutely required. As Professor Reddy has said a couple of times today, we need to be moving on this together. And so we need governments to make that commitment to a fossil fuel phase out, and we need them to do so in a way that recognizes that need to support developing countries, support low and middle income countries in the transition. Otherwise, we won't be able to move together. I think that's absolutely important. And the other thing that I think is really important is we as the health community need to help governments really dial in that this is a health issue that is affecting people here and now on a day-to-day basis. And what that means is that it's not only a cost and a challenge, but also an opportunity. If governments take the decisions to phase out fossil fuels, there are huge potential benefits for health. And so I think that the decision makers on climate change have not really incorporated that into their thinking. So those would be my two calls, is to ask them to commit to a fossil fuel phase out with a just transition, and also to recognize the health implications of all of this, the impacts and the opportunities.
Thank you. I mean, we are heading towards the end. I will ask Dr. Reddy, Sarah, and Andy to give a final message. Thank you, Jenny. It's a discussion that we could be here for many hours. Dr. Reddy, you want to start saying your final message?
I think we ought to tell them, all the leaders, that we are reaching the point of no return. We are very close to that. And unless they act, we are going to be past the stage of really providing any potential protection to this planet. But if we start thinking of what a child born today is likely to experience in 2050 and try and do justice to that child, we will then start doing justice even to those who are alive today.
Thank you. Sarah?
Well, it's kind of hard to top those comments with anything significant or inspiring, but just a small piece of the puzzle and an easy message I think to convey would be, as you are, building back from the pandemic, let's make it a greening health system. Even though it's just a small piece of the puzzle, it is one piece of the puzzle, and we already have this need to build back health systems so that we can avoid or mitigate any future pandemics, and let's do everything we can to make it a green build back.
Thank you. Andy?
Well, these are all great points, but let me just add a couple of my own. One is that I think we could really work to get health in all the nationally determined contributions that countries make under the Paris Agreement. Jenny and her colleagues have shown that the coverage of health is very, very partial, particularly in high-income countries, interestingly enough. So I think ensuring that health, both the health impacts of climate change, but also the health benefits of climate action, are very firmly center of these NDCs, these nationally determined contributions, is really crucial. The other point I would make is that although we have to support the COP process is always going to go at the pace of the slowest, unfortunately. It's a consensus building process. And so that means that we shouldn't put all of our energy into the COP basket, if you like. It's so important, and I think Alejandro mentioned this too, local and national action is so vital. And I think that's where the health community, the health professional community has such an important role in rallying the kind of actors at the national level, but also at the subnational level. We're seeing a lot of ambitious action at the level of city leaders, mayors, and so on. And public health professionals and health can work with city leaders to really advance climate change action at the local level. Thank you.
Thank you so much. Well, our time is over. I would just say one last sentence, and thank you all the panelists, and thank you for the organizing of the event. I think we could be here talking for hours, but I think one last message is like, we need to walk the talk, because I mean, we have the solutions. We have been saying that for years and years and years. I mean, we're talking here about Stockholm plus 50. So it's nothing new, right? That we need to tackle that. So I think we just need to walk the talk, and there are multiple actions at all levels. And thank you everybody, and good luck to all of us, because at the end of the day, we're all in the same boat, right? There is only one planet. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.